across loud and clear. You guys all remember that when you're not, uh-oh, somebody started our broadcast. I'm going to say not now. Hi, welcome everybody to the Transit Talks with the California Transit Association and the California Association for Coordinated Transportation. We're glad that you all keep coming back for these weekly Transit Talks, and today we have a great webinar on recovering from crisis, stabilizing the work environment during COVID-19. I do want to let you know that this webinar is not open for the press. It cannot be duplicated or put in any publication whatsoever without the authorization of the California Transit Association or CALACT. Also, if as an attendee you're all muted, if you want to ask a question, please use your question box, and we'll show you how to do that in a little bit. But there's a question box in your dashboard to the right, and you can type in your questions. We will hold all questions until the presentations are finished, and then once the presentations are all completed, we will start asking our panelists questions. If you have a specific question for one of the panelists, please type their name in the question first, and then we can ask that panelist the question. All the handouts that we have, which they're the PowerPoint presentations and the checklist that Giles is going to go over, are in your handout section of the dashboard. They will also be on the California Transit Association and CALACT websites after the webinar, all the PowerPoints and a recording of the webinar. So if you want to share it with some of your staff. And with that, I'm going to do a quick introduction. So since our panelists are all up on the screen, I'll have them wave as we're introducing them. First, we have Giles Giovinazzi. He's currently a senior advisor to the California State Transportation Agency. Giles previously served as the chief of staff at Caltrans and lead Caltrans and the California High-Speed Rails Authority Federal Affairs efforts. Prior to starting state service, Giles spent 15 years in Washington, D.C., working with transportation, infrastructure, and economic development issues on Capitol Hill. Next, we have John Gasparin. John is with WSP USA and has over 19 years of multidisciplinary experience in the fields of public health and transit. John entered the workforce with a degree in biology, was a licensed registered environmental health specialist in the state of New Jersey, and worked for several years in the fields of public health and epidemiology. 10 years ago, he entered the transit industry and has grown to lead transit policy, planning, operations, and program management initiatives across the country. He was the lead author for the APTA COVID-19 Guide, the New York MTA Global Practices Report, and is presently helping multiple transit agencies with various aspects of pandemic response and their reopening plans. Next, we have Jared Schneider, who is a program manager for CalSTART, focusing on small urban and rural transit agencies across the country. As part of his work, he manages zero-emission bus working groups in the San Joaquin Valley, the Midwest, and the Northeast for transit agencies, as well as administering the Alternative Fuel Disaster Mitigate Action Group, which focuses on planning disaster recovery for transit vehicles with alternative fuels. Jared is based in the Panhandle of Florida. Next, we have Kristen Joyner, who is the founder and president of KJ Backpack. Her expertise includes Transit Association work as executive director for the Southwest Transit Association and administrative public transportation experience for Rock Region Metro in Little Rock, Arkansas. She leads with energy expertise and creativity in executive roles as a team leader and as a subject matter expert. For 12 years, Ms. Joyner has developed and delivered training programs, workshops, and conferences for the transit industry, promoting strong transit workforce development, leadership, and communication across the transportation sector. And last but not least, we have our great operator from Bill Churchill, who is the Assistant General Manager of Administration for County Connection, a public transit authority serving 10 cities in the unincorporated areas of central Contra Costa County. Bill has worked for the authority for 23 years and spent 33 years working in the public transit arena. He has held a variety of positions, including planning, scheduling, IT, and operations. Prior to County Connection, Bill ran the transit division for UCLA and developed transportation software for fleet and traffic management. He has a Bachelor of Science of Computer Science at UCLA with an emphasis in intelligent algorithms. Well, thank you to our panel. We appreciate you guys spending the time today to provide your presentations and give us some good information that we all are waiting to hear. So with that, I'm going to turn the presentation over to Giles, and he will be our first speaker.
Hi, this is Giles Giovinazzi, California State Transportation Association. I just want to check that. Can you see the my screen up here? COVID-19 industry guidance.
Yep.
Yeah, that was the yes, right?
Yeah. Yes, it is. Perfect.
Got it. Okay, great. Great. Well, it's a pleasure to join. Pleasure to join all of you and to do anything I can do to be helpful and supportive of the transit industry. I'm actually a New York City native, so I grew up riding the subway to high school every day. Big fan of public transportation, and I know that it's a difficult time for all of you, and you guys are all out there on the front line. I know the secretary. I'm the senior advisor at the California State Transportation Agency, working for the Secretary David Kim, formerly obviously US DOT and the Federal Highway Administration, but also earlier in his career worked for LA Metro. So someone who is experienced with public transportation and really cares very, very deeply about the subject and wanting to make sure that transit can make a robust comeback, from the COVID-19 crisis, and that you're able to, I think a major concern of his is just that we can just instill public confidence in public transportation. So he was, as the Secretary of Transportation, Secretary Kim was asked to lead a task force that as part of the COVID-19 emergency response, dealing with critical infrastructure. And one of the things the task force did, and I can send Jacqueline the link so she can send it out, but the governor's office put together something called the Resilience Roadmap, which provides, among other things, it provides information in the status of the reopening or the easing of the California state stay-at-home order. I think we're now in phase 2, going to phase 3. Various counties are moving faster than others to reopen various sectors of business. But then one aspect of that is to provide industry guidance. The state of California providing industry guidance to various critical infrastructure sectors, everything from logistics to construction to shopping, to grocery shopping and warehousing and various other sectors. And one of the sectors was public transit and intercity rail. And so this guidance, you can see if you go to the Resilience Roadmap website, you can find this and the other industry sector guidance that has been provided. It's essentially intended to be a best practices document. It is not regulatory. It's not enforceable. There's language in here that says must, shall, etc. But this is essentially a guidance document. A lot of it, most of it, aligns with CDC or borrows from the Center for Disease Control guidance that's been given out. I know that there was transit industry CDC guidance that was published. So a lot of this is basically repeating that. In some instances, it goes a little bit further. I'll say at the outset that this document is supposed to be updated shortly to include rideshare, taxi, and private transit and intercity bus. I don't think the provisions that affect public transportation, transit, and intercity rail have changed in any way, but that's forthcoming. So I'm just going over what's been published so far, and you can see at the top, it's right now it's on the letter. It's California Department of Public Health, Cal SDA, and Cal OSHA had a hand just in developing this document. I'm just scrolling. So I guess it was published in May 12th, kind of an overview, giving the background, key prevention practices you can see that are outlined: physical distancing to the maximum extent possible, the use of face covering by employees, and again, there's more detail in the document, frequent hand washing, training employees on these and other elements of COVID-19 prevention plan. So keep, here's the explanation of the purpose of the document. The document provides guidance to public transit agencies, California State Supported Intercity Passenger Rail. The guidance is not intended to revoke. Okay, there's something in here. Stay current on. It is not intended to conflict with federal or state requirements for rail and transit vehicles or facilities. Just wanted to point that out. And then again, I had mentioned the Center for Disease Control guidance. So there are hyperlinks in here to what has been published by Center for Disease Control for bus transit operators, rail transit operators, transit maintenance workers, transit station workers. There has, since this was published, there's been new CDC guidance that gets into ride shares, taxis, and so that will be the CDC guidance will be incorporated in the updated document. So the first element, it's asking for transit operators to put together a worksite specific plan. Contents of the worksite specific plan should, persons responsible for implementing the plan, a risk assessment and the measures that will be taken to prevent the spread of the virus, training and communication with employees and employee representatives on the plan, a process to check for compliance and to document and correct deficiencies, a process to investigate COVID cases, alert local health department, and identify, isolate, close workplace contacts of infected employees until they are tested. So sort of a contact tracing element, and update the plans as necessary. I'm just a high level summary of what you can see there on the screen. Various topics for employee training are included. Information on COVID-19, preventing the spread and who is especially vulnerable, self-screening at home, including temperature and/or symptom checks, the importance of not coming to work when employees have a frequent cough, fever, difficulty breathing, chills, etc., when to seek medical attention, the importance of hand washing, the importance of physical distancing, proper use of cloth face covers, or some of the, you can see this. These are suggested training topics. Information on employer or government-sponsored leave benefits. So individual control measures and screening is the next section. Temperature and/or symptom screenings, encouraging workers who are sick or exhibiting symptoms of COVID-19 to stay home, encourage frequent hand washing and use of hand sanitizer, provide and ensure workers are all required protective equipment. More guidance on face covering, strongly recommended when employees are in vicinity of others. Non-employees entering facilities should be restricted to only those classified as essential. Public transit or rail agencies must take reasonable measures to remind the public that they need to use face coverings and avoid directly facing other passengers when distancing is difficult. Now, this was an issue, I think, on prior webinars or in our discussions with transit and rail agency officials. This is a difficult situation since intercity rail and transit will often pass through local jurisdictions with different rules regarding face coverings, particularly during the early days of the COVID-19 crisis. They seem to be more widespread today. And I know there was some thought of, or some expression of a desire to have the state come in and try and mandate, face coverings for passengers to take intercity rail or transit. This is as close as we've gotten at this point, but it's basically a recommendation that public transit and rail operators essentially put together a policy telling passengers that they should be wearing face coverings if they're taking public transit and rail. Again, so the next section is cleaning and disinfecting protocols. Perform thorough cleaning on high traffic areas. Some of these come straight out of CDC guidance. A lot of it does. Perform routine cleaning and disinfection of all frequently touched surfaces. Clean all areas of drivers' cabs between shifts or users, whichever is more frequent. Avoid sharing phones or other work tools. Use products approved or for use against COVID-19 by the EPA-approved checklist, and there's a hyperlink there. Equip stations, transit and rail offices, and transit and rail vehicles with proper station sanitation products, and provide personal hand sanitizers. ensure sanitary facilities stay operational and stocked at all times, and consider upgrades to improve air filtration and ventilation. Next section, and we're more than halfway through now, is just physical distancing guidelines. Implement measures to physically distance transit and rail operators and passengers by at least 6 feet using partitions or visual cues, floor markings, colored tape, or signs to indicate passengers how to avoid sitting closely to the bus operator. Encourage passengers to wear face covers when physical distancing is difficult to maintain. Request passengers to avoid standing or sitting within 6 feet of operators. Reduce onboard maximum occupancy to support physical distancing. Stagger employee breaks in compliance with wage and hour regulations. There you go. Reconfigure or restrict close common areas and create alternative space for breaks for physical distancing is possible. Require and encourage passengers to purchase tickets and add value to transit and rail cards online. Allow and encourage passengers to verbally request stop to avoid having activate the stop request signal. Get to the end here. Develop a passenger entry and exit plan to minimize physical contact. Operators should sanitize hands before and after assisting passengers using wheelchair, and communicate the updated ridership practice and any changes to the frequency of service timetables to the public. So that's the basic guidance. And again, I can send a link to Jacqueline, but this is, I think if you Google California Resilience Roadmap, it'll take you to where you can find all the different industry guidance. Let me take this down real quick. And then, sorry, I don't know if you can see this. Can you see this checklist that I have here?
Yes, we can. Thank you.
Okay, good. So yeah, so again, this is just an abridged version of the guidance, but it's basically something that transit operators can use just to just to show that they're tracking their status on the best practices that are recommended. I believe this checklist, well, it's in your packet. I believe this is also online too, with the best practices that I outlined. And again, it's just a shorter version, but with checks, so you can see your own progress. And I'll take this down. Translate that. Bring this back up. So that's all that I have. If there are any questions.
We're going to do questions on the very end, Giles, and we don't have any yet. So thank you so much.
Okay, thank you. I'll be standing by.
Okay, thanks. So we will change presenters, and there we go. So next we have John Gasparini. John?
Hello, everybody. Can you hear me?
Yes.
Okay. So I'm here to talk about the APTA COVID-19 guide. It has a much longer title, but I'm going to call it the APTA COVID-19 guide for today. It's a national level guide. APTA distributed it to, we can go to the next slide, by the way. APTA distributed it to virtually all transit agencies in the US, I think it was either evening of April 13th or beginning of April 14th. And there's definitely some similarities in the scope between this guide and the document that Giles just presented. And there's also some differences. And I'm gonna walk you through the guide. Even if you're already familiar with it, I'm gonna point out some things that might not be obvious on surface level that could be helpful to you. And then I'm also going to talk a little bit about what's happened in the industry since the guide was published. So this guide, just to be clear, it was written for senior transit ops leaders. It was written to be a little more like an outline style format. You can see on the screen that it includes a snapshot of CDC guidelines at the time. As Giles has suggested, the public health guidance has continually evolved and will continue to evolve over the life of this pandemic. A unique element of this document is contributions from faculty at the Johns Hopkins Bloomberg School of Health, which are very transit oriented. There's also a number of strategies and tactical options that agencies can consider for protecting human health. There's some considerations in here for supply chain resiliency, and keep in mind that supply chain resiliency was much more of an issue back at end of March, beginning of April than it is now, but still somewhat of an issue. And then there's a little bit of information on documentation required by FTA for reimbursement of expenses. The guide's available on APTA's website. The link is there, and we can flip to the next slide. So I'm not going to spend a lot of time on this, but I wanted to point out that we drew from a lot of CDC guidance outside of the guidance that was provided just for transit. And at the very end of the document, there's a ton of citations. Anywhere in the APTA guide, you'll see little footnotes that you can go to. You can click them, and you'll be able to get right to the source CDC guidance if you want to see exactly how CDC couched something. This is just showing you a sample of the types of guidance that was called out of the CDC website. We can move to the next slide. So this is probably one of the more interesting elements of the APTA guide. At the time that the guide was substantially complete before CDC had put out their transit guidance, and in general, the guidance that we were seeing from CDC still left a number of questions unanswered for the transit industry. And so we got a small handful of faculty from Johns Hopkins out of the goodness of their hearts to go on the record and help synthesize existing CDC guidance from other nooks and crannies of their website to answer some very transit specific questions. And I'm showing a sample of those questions here on the screen, but some of these still aren't answered directly in the CDC guidance for transit, only really through this Q&A that we did with Hopkins. One of the ones that I think is really important just on this slide alone is not to dry sweep our vehicles when we're cleaning. The notion being that the virus can attach to a piece of dust, and there is a potential that an infectious particle could become airborne when we're dry sweeping. So always use wet methods, and I know that not all transit agencies have focused in on this one yet. So I thought that one was particularly interesting and helpful. You could see on the screen the one about HVAC use and really trying to bring in outside air as much as possible. And this is a big area of emerging research, not just for transit, for the whole pandemic, is thinking about how indoor air quality factors into inhalation of respiratory droplets, right? Like we all know that inhalation of droplets is the easiest way to get sick. So that's why indoor air quality is this emerging area of study. And there's this note here that points transit agencies to an element of that. So there are more Q&As that are in the document. And if we ever pump out a version 2 of the document, there's always the chance that we can include additional Q&As. I would also just take this moment to say that if there are folks on the line with transit agencies, and if you're working with your public health department, posing questions like the ones you see in bold on the screen is the easiest way to get advice from the health agency, because the health agencies typically don't understand the nuances of a transit operation. So by posing a question the right way, you kind of force the health authority to educate themselves on the nuances of before they provide an answer. So I hope that's helpful to you. So we can move to the next slide. You could see a screenshot of a sample page out of the document. You could see instead of there being paragraphs and narrative, it's really bullet points. You'll notice that the document is generally divided up by activity, operational activity, and by facility type, and that makes it easy for an operations leader in an organization to almost use the document like a checklist and to contemplate what are all the things that I might want to consider in a given location of my operation. We also divided it up into things to protect the agency and the agency's employees, and then a different section for riders. And there was a section in there on safety assurance, you know, to the extent possible, how a transit agency can make sure that things are being implemented as they intend, as they hope. So we can flip to the next slide. This is I think it's one of the most interesting tables in the document, and you know, some people I think have really gone into the detail of this table, and some readers may not have. We did a lot of market research at the time to determine, like we went through all of EPA List N in April, like everything. And we started trying to do research, what nationwide distributors had these products in stock. And essentially, you see on the bottom row, things that are green and yellow. At least back in April, this is showing general indication on, you know, what types of products were in stock and which ones were back ordered. You see at the top of the table that we divided this up by application method, right? Dilutable liquid, ready to use liquid, towelettes and wipes, solids, fog. And another interesting thing in this table is we actually did the math based on a substantial sample of each product type. We did the math to determine, after you mix up the product, after you apply it in the volume necessary to achieve a SARS-CoV-2 kill, about how much money is it costing you per square foot to use each of these types of products. And the cost differential is massive when you move towards the right-hand side of the screen. The cost per square foot drops considerably, at least in terms of the cost per the solution of the liquid solution of the disinfectant. So I thought this table was interesting and worth explaining some of the detail that's in there. You know, there is a whole bunch of stuff in the document on PPE. That guidance hasn't changed very much since the APTA guide was published. We did have this whole section on alternative PPE for back when it was way harder to get masks and gloves and stuff like that. So that's in there too. We can flip to the next slide. This is the last slide of the presentation. I just wanted to touch on a number of things that have changed since the APTA guide was published. As Giles has said, for the California guide, the APTA guide may be updated to include these things, but you know, in general, there's been a lot of scientific research out there that has pointed to the importance of universal masking, meaning everybody wears a mask, and the more people that wear a mask, just drastically the lower the infection rates. And this is what early guidance and early research is saying, starting right out of Wuhan. And you know, I've heard of some transit agencies measuring, trying to estimate the percentage of mask usage by riders so that they could at least monitor it and see if their communications to the riders is contributing to an improvement in proper mask usage. So that's really important, and that importance of universal masking was not evident to US public health officials back in April, but it was becoming evident back then. Expanded employee screening criteria. Essentially, since the APTA guide was published, the CDC has added additional signs and symptoms of COVID-19 to their list of screening criteria, and that's pretty important if you're screening your employees. Also, CDC has published guidance for critical infrastructure workers that do not have the luxury of staying at home for 2 weeks if they've been exposed to somebody else with COVID-19. And so there's some guidance out there on what to do if you don't have time yet to take a test and you don't have time to stay at home. How do you minimize the chance of spreading the disease amongst coworkers? And then there's also been a pretty cool study out there mask decontamination and reuse. So especially it's specifically for N95 masks and KN95 masks. The study basically goes through the different ways that you can decontaminate the mask and how many decontamination cycles you can go through with each method before the structural integrity of the mask is compromised. There's more. I mean, this list goes on. There's lots of emerging areas of research. I touched on the indoor air quality one. But I guess the point is that even as we stand here today, every day that goes by, scientific information on the virus and the disease is evolving. Some of you may also be aware that APTA that recently launched its Mobility Restoration and Recovery Task Force. Basically, this is a rather large group of people basically facilitated by APTA members, led by some of our nation's industry leaders, CEOs from 3 different transit agencies, support from public sector, and the charge of the group is to put together plans for how the industry at large can respond and recover from this pandemic, and also plan for future pandemic resiliency. There was a recent announcement, and this is pretty cool. We call him Dr. Ram. So Dr. Ram from the Johns Hopkins School of Health was recently added to the task force to provide scientific advice to the task force. I think this is fantastic. Personally, I believe that most people in the transit industry, most people in any organization are not formally trained in medicine and health, and we're all trying to solve a medical problem. And so the idea of bringing in people from the health department and bringing in people from academia to provide scientific advice to the decision-making processes is huge. And I think it's great that APTA added Dr. Ram to their team. So that's my presentation. And I guess when we get to the end, I'd be happy to answer any questions.
Thank you so much, John. Next, we're going to have Jared Schneider from CalSTART. Thank you, Jared.
Thank you very much, and thank you very much to CalAct for having me here. So I'm going to talk about CalSTART's standard operating procedures for COVID-19 that we developed. So if you want to go to the next slide, Tenley. So just a little bit about me, just so you guys kind of know where I'm coming from here. I have over 10 years of transit experience from manufacturing to operations. As you may have heard in my bio, I administer the Florida Alt-Fuel Disaster Mitigation Action Group. I developed the standard operating procedures for the emergency and disaster scenarios for the electric buses and Minneapolis Metro. I'm a certified wheelchair securement trainer through CTAA, and I've owned my own NEMT company in Florida and also sit on my Transportation Disadvantage Board in Bay County, Florida. So I have a little bit of experience here. So if you want to go on the next slide, please. So a little bit about CalSTART, and I'll be brief on this. For those of you who don't know, we're a nonprofit, national nonprofit, working all across the country in transit, trucking, and infrastructure. And we're a member-based organization. And in California, we have 3 offices, being in Pasadena, in Fresno, and up in the Bay Area. Next slide. So here's just a list of some of our members, and some of them are probably online right now as well. So you can go on to the next one. Just a little bit about what we're doing right now and what's kind of informed all of the reason that we developed these standard operating procedures. I administer the San Joaquin Valley Zero Emission Bus Working Group, and I saw some of our working group members on the call here today, so hello to all of you guys. We also have the LA County ZEB Working Group. We administer the HVIP program, the CMO program, the Clean Transit Innovation Network, and I'd also draw everyone's attention to the Clean Commercial Transportation Update, which is a weekly 30-minute update on what's going on in clean transportation, where we touch on issues with COVID, how it's affecting transit agencies, how it's affecting trucking, what the developments are around the world, just in different sectors. So just something of interest there. But if you want to move on to the next slide, please, Tenley. So working all across the country, we get a lot of feedback from people, and we started asking all of the agencies that we work with, what is it that we can do? Like once the crisis started hitting, once everything started shutting down because of COVID, transit obviously is an essential service. So we said, what is it that we can do to help and to bring really bring something to the forefront that can help transit agencies? And what we found were that a lot of agencies were getting information, and fantastic information. Like John's presentation on what they've done with APTA is fantastic, and it truly is an excellent just document, and the information is fantastic. But you see a lot of the times where agencies will come up with, okay, we're supposed to develop procedures and processes, and we aren't really sure where to start. Some of the larger agencies may have that ability to create those documents themselves internally, whereas we found a lot of the more rural agencies, the smaller agencies, may not have that expertise on hand or even the bandwidth at that point to even do it. So we came up with developing these standard operating procedures. Like I said, I had already done the emergency procedures for Minneapolis Metro. I already had experience in this through just my own personal experience operating in a transportation setting after Hurricane Michael, and just knowing the pressures that can be put upon transit in a high stress environment. So we started developing these standard operating procedures. So if you'll move on to the next one, Tenley. So I'm going to put this out there because I've been told I need to go ahead and make sure there is a disclaimer here that the SOPs are meant as references and guidelines and shouldn't be construed as absolute solutions for mitigating and protection against transmission and infection. These are more of a framework, and that your individual agencies can build your policies upon. All right, so that out of the way. If you can move on to the next one. So again, we looked at what it would take to actually develop standard operating procedures. As Giles said in his checklist, making sure that you have certain processes in place, and then leaving it up to the agencies to develop those processes is exactly right. We just said, well, let's go ahead and develop this framework for trans agencies so that you can adapt them to your individual agencies. And just taking our past experiences in operating and knowing how to secure wheelchairs, and having the expertise in actually operating and driving vehicles for transit. So we left these as Word files, so they're open source, so that way you're able to alter as needed. And then this will allow you to develop kind of your own best practices that can be improved upon by each individual agency as your needs may come about. So next slide, please. So what these are going to cover, there are 5 of these that we've developed, and we can develop more along the way, but just starting out, we had SOP 1.0 through 1.4. So 1.0, loading a passenger with existing symptoms. 1.1 is approaching a passenger with symptoms prior to alighting and with mobility aid. Next one is the wheelchair securement of a passenger exhibiting symptoms. And then 1.3, actually denying service to a passenger if your agency is going to do that. How should you do that, and what are the next steps to doing it? Because we know that for all transit operators, your first and foremost goal is the safety of your passengers and of your drivers. So the question is, if you're going to deny someone service because their passenger is already on the vehicle, you don't want to get anyone sick, you don't even want to take the chance of that happening, how is it that you deal with this? Like, what is it that you do at the very beginning, and how do you move on to the next step? I would also kind of go back to the 1.1, the standard operating procedure 1.1. I think this is really important on how to approach somebody that has possible symptoms, because we don't want to take any chances with any of our employees, with any of our transportation workers. We have to make sure that they're safe at all times. And putting these processes in place is incredibly important to make sure that as they're approaching someone, how do they do it in a proper manner? If you just leave people up to their own devices, they may not know, they may not be thinking through it. And as you know, and everyone knows, as a transit operator, we have to go through training all the time. We have to make sure that all of our people know what the steps are so that they're able to follow through on those and not just kind of leave things out in the open. And everyone's trying to figure out what we're doing as we're moving through this kind of, through this pandemic. And as John said, there's new information coming up all the time. How are we adapting to that? So putting these processes in place now and being able to amend them along the way will help to secure the health of all of our transportation workers as well as the other passengers on board. And then the last one, the SOP 1.4, this is a follow-up on the denying service to a passenger. If you were going to send out a secondary vehicle to pick up that passenger, this is following through on what that supervisor would be doing or that driver would be doing to actually to pick up that passenger and what to do as your next steps. Next slide, please. So we do have the SOPs. They're actually in the handout here in your toolbox on your toolbar on the right-hand side under handouts. They're in there in PDF form, but if you'd like them in the Word doc form, you can email me or email Jackie or Tenley, and we'll get those over to you. Also, they're on the Clean Transit Network. They're up on Florida Transit's site. I believe Metro Magazine is putting them up as well in the coming weeks. So please feel free to reach out to us. And if you need anything from us or need any clarification, we're more than happy to help. Next slide, please. So this is one thing I would ask everybody that's listening to this, that's kind of thinking through how it is that you're going to continue operating through this pandemic and what comes next. Think through what additional standard operating procedures you would find helpful, and also what additional resources could be developed to assist you moving forward. And I say that second point as kind of a much broader topic, because as you've seen from John and from Giles, there are documents that are being developed all the time. There are resources that are constantly being developed, but without any kind of guidance from you, the transit operators, not everyone knows what to make. I mean, I could make a document tomorrow. I could create it that no one actually needs. Well, that doesn't help anybody. Giving us input and telling us what you need, a lot of us have the resources, the connections, and the capabilities to put things together that can really help you. So I would highly recommend just reaching out to us, reaching out to Tenley, reaching out to Jackie, reaching out to your associations to really kind of direct that conversation and figure out what it is that you guys need and relay that back to anyone that's able to help out. So next slide, please. So again, this is my contact information, and it's that little circle supposed to be over my email address. So please reach out to me if you have any questions, if you have any other needs, or any, like I said, if you want other SOPs developed, we're happy to do it. We want to be able to help out transit agencies in whatever way we can. This was one way, and if there are more resources that you're looking for, we can hopefully connect you either to resources that we have or other people that we know throughout the country that may be able to help you out with that. So next slide. So these are just a couple of just upcoming events of interest. Again, this is just other things that are going on that we're just involved in. So that Clean Commercial Transportation Update is on Friday. Please sign up if you're interested in it. It really is a lot of great information. Also, we have a San Joaquin ZEB working group meeting. So for all of those of you on here that are part of that, we actually are changing that to June 29th, so the week after. Sorry, there was a last minute change there. And then also for all the trans agencies, since none of us are able to travel really right now and we're all kind of locked down, we are hosting a virtual site visit at New Flyer in Anniston, Alabama at their Vehicle Innovation Center. And we're going to have a panel discussion on better electric buses versus hydrogen fuel cell electric buses. That's going to be on August 4th, and you can reach out to us to ask how to be a part of that. But again, kind of looking at how we're moving forward in this world that we're finding ourselves in, where where people aren't traveling as much, and we're seeing all kinds of issues arise. How is it that we move forward? How do we still disseminate information? How do we get information, and what information is it that we need? So I guess we'll save the questions to the end, and I'll wrap it up with that and just say thank you to everybody there.
Thank you, Jared. And next, we're going to go to Bill Churchill from County Connection. And I just want to remind people that they can ask questions in the question box. So, Bill?
Well, thank you for allowing me to be here and share some of our thoughts and our experiences. As I've been listening to the 3 prior speakers, I can tell you that I wish I had their information back when we were beginning this whole process in February. Next slide. Oh, you're there, never mind. You know, thinking back and looking back to mid-February to maybe mid-March, this was really a challenging time for our authority. And I don't think we were doing it well. We were struggling with communication, with SOPs, with even what we should be doing to and for our operators and our passengers. And I think it's because there was such a bewildering array of information coming in. The news media was chaotic at best and oftentimes contradictory. Even the CDC guidance seemed to change from one week to the next. In fact, the CDC guidance, I think, contributed to some of the challenges, early challenges and difficulties that we had. For example, last year during the fires in California, we were fortunate to have purchased a large supply of masks, and we allowed our operators to wear those masks in the field to protect themselves from the smoke. Well, of course, as the fires dissipate and winter comes along, the masks aren't needed. But as this pandemic began to unfold, our operators were once again asking for masks. Initially, the CDC guidance informed us that masks were not needed for healthy individuals. Rather, individuals that were exhibiting flu-like symptoms were the ones that needed to wear the mask to prevent disseminating whatever they had to the rest of us. Well, we of course then asked our operators not to wear the masks, only to a week or two later receive new guidance from the CDC recommending that everybody wear the masks that come into contact with the public or other individuals. So I think this back and forth kind of contributed to a level of fear, if you will, on the part of our frontline workers. And in the middle of all that chaos, we had a passenger inform us that they had been infected with COVID, had ridden a paratransit vehicle and come into contact with other passengers and the operator. And of course, we didn't really know what to do at that point, and that added to our chaos. And within a week of that time, of that incident, one of our fixed route operators came down with a very serious case of COVID, ended up in the hospital. And it was at that moment that I think chaos really completely ruled the day, and over 50% of our fixed route workforce left and went home sick, leaving us in a really challenging spot. So we realized that we needed to work at this. We needed to find guidance. We turned to APTA, we turned to fellow operators, and more importantly, we turned to our local county health office. And I have to say they were probably the most effective tool that we ended up using. They provided a tremendous amount of support in developing SOPs, developing best practices. They sent a county health officer to our site on multiple days across multiple weeks, providing training for all of our employees regarding health and safety and the impacts of the COVID and how to mitigate it. And I think that probably went the furthest to help dissipate some of the fear that our employees were experiencing. Next slide, please. So it's impossible for me to provide a complete description of the depth and the breadth of everything that we implemented across all the components of the authority. So I'm going to just kind of brush on a few of the most important ones. And then if anybody has questions about nuance and what we did and how we did it, I'm certainly happy to answer those questions at the end of this session. So I'm going to divide it into categories. So for our operators, we realized that we needed to do something very tangible, and doing something tangible and putting something in their hands, I think, is more important than even just providing memos and documents, although that is important. So we, at the very beginning of April, right after our employee came up with the COVID positive test, we put together these health kits for every operator. And the health kit included masks, gloves, wipes, and hand sanitizer. And we gave that kit to every operator on Monday of every week. And we have been doing that ever since. We currently have no plans to stop doing this practice. It's a way of making sure that every single operator has the tools that they need to protect themselves every single week. If an operator goes through all that material, they are welcome to ask dispatch for more, and they are provided more throughout the course of the week as well. And many operators do that we have some operators that go through quite a few wipes, as you can imagine. We suspended all attendance rules. This was really a challenging thing for us, but you know, attendance rules really are a foundation of transit agencies, and they allow us to run our services on time and do what we need to do in the field. But we recognize we need to remove any barrier to an operator or a frontline employee that might feel ill but be afraid not to come to work. So we decided to go ahead and do that. Also, we sent home all operators over the age of 65, and we sent them home with pay. Additionally, we provided hygiene safety training, and we also instituted pre-screening at the dispatch window. So as operators show up to get their bus, the dispatchers will ask them a series of questions about their health. And if they don't pass that screen, they're sent home with pay. All these things were our attempt to remove that barrier of people being afraid not to come to work. They know they can stay home if they're ill and not spread this virus to other employees or our passengers. We required any and all employees that felt ill, that exhibited symptoms, to just self-choose and not come into work. Next slide, please. Within the administration, we created alternative work schedules so that people would work every other day, or in some cases, some would work half days and others would the other half day. All employees that had the capability of working at home were told to do so. Our goal was to cut in half the number of individuals working within our buildings at any given time. And we've been successful at that. We require anybody walking through any building or facility here at our yard to wear a mask. The only time you don't have to wear a mask is when you're sitting at your desk, like me at the moment. But if I get up and leave my office, I'm required to put my mask on. These rules are still in place today, even though our county is beginning to open up, and we don't have any plans to relax these rules in the near future. We also instituted requirements for very small meetings, and social distance protocols must be adhered to. Throughout our buildings, we posted signage explaining and educating regarding hygiene and social distancing, and we put tape and markers on the floor just to provide visual cues to know where you should stand to help encourage that social distancing. Next slide. On our vehicles, we began an antibacterial and viral fogging system that we do every single day on our buses. And in fact, if a bus returns to the yard from the field and is scheduled to go back out, it will get another treatment of fogging. Our authority was very fortunate in this, unlike many others. We actually purchased the fogging systems and the chemicals last fall. our maintenance department was struggling with how to deal with individuals or buses where individuals became very ill and sick on them, and we needed to pull those buses out of service. Wiping down all the surfaces in a bus takes hours, and they were looking for a faster way to do it. Well, who knew that this pandemic would come about? And we just happened to have the materials and the equipment to institute this program right away on all the buses. We instituted a rear boarding policy for all ambulatory passengers, and we stopped collecting fares to minimize the interaction between our operators and the general public. We also, our maintenance department designed and built their own plexiglass shields and installed them on all fixed route buses at the driver compartment. This was also a reaction to the operator that had come down with the positive results of the COVID. It took about 3 weeks. So it was, I think the second week in April, and by the first week of May, every single bus had a plexiglass shield installed. Again, these types of things, the necessity is really the mother of invention. And we knew we had to do something. And even these shields have been modified over time and improved. We found at night that they created glare for the operators, and they were complaining about it, but they didn't want them removed. And we found that we could add a special magnet system so that the shield can be opened and it connects to the stanchion on the other side of the bus at night. It blocks off the rear compartment of the vehicle, but it allows the operator to still have that protection while moving and not have the glare. We posted educational signage similar to the one that you see on your screen in multiple languages on all buses. This is just one signage. There's another one that talks more about hygiene and what our best practices for hygiene for all of our passengers. We do enforce physical distancing. We only allow 10 people on a bus, and we enforce masks as well. Next slide, please. So moving on to a different subject, I think like every other transit agency across this nation, our ridership absolutely plummeted about mid-March. Our fixed route plummeted 85%. And then right at about the same time, the shelter at home order was issued by our county was about the same time that our employee came down with the COVID virus. And we lost about 50% of our operating workforce on the fixed route side. On the paratransit side, we lost, our demand dropped 91%. But unlike the fixed route, we did not lose our operators. And so we found ourselves in this position with a massive resource, but really nobody to move. Next slide, please. So we really reinvented paratransit services here at County Connection. Since we had this massive resource, at about the same time, we were hearing that the operators for Meals on Wheels in Contra Costa County were not showing up to work. It turns out that predominantly most of their drivers were over the age of 65 and retired, and those individuals were not coming to work. Well, we thought we'd approach Meals on Wheels and let them know we have a resource, and maybe we could help them deliver meals and deliver meals to our former customers. Well, Meals on Wheels accepted us gladly. They put our operators through a surprisingly very complete training program, and we began delivering these meals. To date, we've delivered over 3,700 meals in that program alone. And as often the case, when you do one thing right or something successful, other people see it, notice it, and come and ask for help. So over the last couple of months, other organizations have approached us, asked us to partner with them. So we are now partnering with the Mount Diablo School District to deliver meals and groceries, the City of San Ramon Senior Meal Program to deliver meals and groceries as well, and the Contra Costa County Food Bank. To date, we have delivered thousands and thousands of meals and well over a ton of food and groceries to people across the entire county of Contra Costa. In addition to this program, the county, Contra Costa County, approached our paratransit program and asked them if they'd be willing to move COVID positive individuals to healthcare facilities. We were, as you can imagine, very nervous about this. And we knew that we couldn't just do this alone. So we partnered with a transit agency that's our neighboring to us, to the east, Tri-Delta Transit. And we worked together with Contra Costa County Health Services. They provided specialized training, specialized PPEs. We separated a small segment of our fleet and specially equipped them to isolate the driver compartment to keep them isolated from these particular passengers. And we began moving COVID positive patients to medical facilities with volunteer drivers and operators. I just, I can't believe that we have drivers that are willing to put themselves at risk to help our community in such a profound way. It's just such a good feeling. In addition to the COVID transport, the county also recognized that the homeless were at particular risk, and they had decided they wanted to move the homeless to hotels, and they would be better able to feed them, provide medical care. They also realized that in a hotel, the HVAC systems are independent to each room. That also, according to our county, felt that would stem the spread of the COVID disease. So again, with Tri-Delta Transit in partnership, we began moving homeless to hotels all throughout the county. Anyway, these programs ended up being remarkably successful. It's not what we would have ever imagined we would be doing in a million years. And despite the challenges and how wearying dealing with some of these issues of this pandemic are, I have to say nothing has been as heartening as watching this program be successful in actually supporting and meeting the needs of our community. This program also has had an unintended consequence, which I think is positive at the moment. Unlike some of our neighboring transit agencies where the paratransit, as the counties begin to open up, the paratransit demand begins to increase. Our paratransit demand has not really increased all that much. We think that the meals that we're delivering are in part going to those that would have in the past been our passengers. And so now they don't need to leave their home to get groceries still yet. So as we open up and the drivers come back to these various programs, we will then begin to be able to provide more services to our prior customers. And it looks like this is happening currently in sort of an organic balance, which is kind of surprising. So this has also been another surprising side effect of doing these services. Next slide. Challenges moving forward. They are profound, and we don't have the answers to them. And we are working with our sister agencies. We're working with APTA. We're working with our associations, CalAct and CTA, as we try to figure these things out. One of our primary challenges is social distancing. I put a chart on the screen. You can see that we can only put 10 people on a 40-foot bus and maintain the current social distancing requirements. We can only put 3 individuals on a paratransit vehicle. As things begin to open up and our passengers begin to return, there is no way we can meet the demand that will ultimately be out there. If this coming fall, the schools open up, we have many routes that go by schools, oftentimes carrying as many 60 students on one bus. We do not have the resources or the capability to provide enough buses to move those kids to school. So this is a conversation that's not just here in Contra Costa County, but rather one that's nationwide. How do we contend with this and have transit still be effective as we begin to open up the doors? Another issue that we're realizing that we have to deal with is there is a real fear of transit. MIT put a study out that suggested transit is one of the reasons COVID virus has spread. And we are grappling with how do we convince our former or potential future customers that it's not unsafe to take the bus, that all the measures that we do, how do we communicate what, and all those measures that we do take are there to protect them and that they are okay. And then finally, for us, the funding shortfall in the future. Through today's lens, the future is very grim. Fortunately, the CARES Act provided us enough funding to provide services through this coming fall. But next spring, outside of any additional funding, it looks like we will be forced to completely restructure the services we provide in order to survive. We are looking for that pot of gold at the end of the rainbow that's on the screen. So with that, I'll end my presentation and take questions at the end of this program. Thank you.
Thank you so much, Bill. And last but not least, we have Kristen Joyner with KJ Backpack. Take it away, Kristen. Kristen, we can't hear you.
Can you hear me now?
Yes, we can. Thank you.
Awesome, awesome. That was such a good presentation, Bill. Actually, everything that we've heard today has just been truly awesome. Really specific policies, protocols, checklists. And, you know, these are the really crucial things that we need to be laying a foundation for our employees to help them feel safe in the work environment. There are a few things, though, that I want us to think about right now, and they involve the human side of the equation. It's the things that that will help employees recover quicker and promote a stabilized work environment. Next slide, Tangley. So, are department potlucks, employee appreciation parties, and driver room ping pong and dominoes a thing of the past? They may be. Those that have been on site or on base for the last several months have kind of figured out what is the protocol, what works, what doesn't. But those coming back into the workplace from being at home, they're going to need an awful lot of guidance. And that's why hearing all of these ideas today is so important. You don't want to leave any of this to chance. You don't want people to just figure it out on their own. You really are going to have to set out some rules and then follow through with those rules, those protocols. A GM that I talked to recently shared his frustration at having to be the bad guy when he discovered one department when everybody came back to base after being at home, they were going to host a potluck on their first day back at work. And he said, I know that they're happy to be together and they want to celebrate, but what are they thinking? You know, you're probably thinking that also. What are you thinking? And yes, he had to walk down the hallway with his mask on and say, we are not holding this potluck. We're not sharing food, period. That's our rule. He had to be the bad guy. And so what are some of the other bad guy things that you're going to have to think about? Well, directional signs. Bill shared a lot of very good operational ideas. So what about directional signs, and how are you going, like in the locker room, and how are you going to enforce that? What about face masks? You know, does everybody wear a face mask? One agency that I heard about says everybody wears a face mask unless they're in their own private office. So if you have a private office, you can take your face mask off. Well, now that the bus operators at this agency, now that they have plexiglass up, they are saying that their office is right there behind the steering wheel in their seat because the plexiglass is there. That's their office. So how are you going to deal with that? There's you're going to have to think about ways to overcome when people don't want to do something. So whatever the rule and policy is, getting employee buy-in is really the key. And I want to give you a few tips about that. First of all, explain why. If you can explain the why, the rationale, the science behind it, then you're probably going to get really far down the road in terms of buy-in. The other thing about buy-in is tapping into that radio station that everybody has inside their head. It's called WIFM, and you might want to write that down, because in dealing with people, when you can tap into their what's in it for me, then you can get buy-in. So tap into their radio station, WIFM, and you'll begin to see some buy-in. Another idea is to ask ideas on implementation. Any idea, big or small, that comes from the ranks, if you implement it, that for sure creates buy-in. And another thing, and really the final part of this, is to be very clear about what the goals and objectives are. Then enforce them consistently. The consistency is truly key. And it's not just you, it's everyone around you. It's your entire team has got to implement and enforce whatever the rules are and do it consistently. What this does is it will build not only your own personal credibility as a leader, but it will also build trust and credibility for the whole organization. Next slide, Tinley. So there's many emotions that are at play right now in our transit family. Fear is one of them. And if you look at fear, it's a natural, powerful, and even primitive human emotion. Fear alerts us to the presence of danger or the threat of harm, whether that danger is physical or emotional. And sometimes fear stems from real threats, but it can also stem from your imagination. You know, what is this virus that we have that we can't see, this unseen enemy, and how is it affecting all of us, but especially our frontline employees and those that are coming back into the workplace? How's it affecting them? The other thing that the other emotion that some of your employees may be dealing with is resentment. And it's that resentment may be there because you have frontline employees who truly were at ground zero, while another portion of your workforce was working safely at home. And that resentment is there whether they're saying it or not, but it's going to come out in different ways. So to get your team moving again, there is a leadership principle that you can practice and put into place, and it's empathy. And not everybody knows what empathy is. And the best way that I can describe it is to say that it's being others focused. It's the ability to step into the shoes of another person and really understand how they're feeling. Some people get empathy and sympathy mixed up. So I want to give you a couple of clues about that. Sympathy typically is related to sadness and sadness only. But empathy is related to both sadness and happiness. You know, you can step into somebody's shoes and feel their sadness. You can step into their shoes and enjoy the happiness that they feel. The other differences, or a couple more differences, sympathy is feeling sorry for someone, but empathy is actually saying, you're together with me. You know, you're not in this alone. We're together in this. And when you add in that togetherness, that's when it becomes empathy and leaves the realm of sympathy. So when one of your team members tells you something happy or sad, be with them in the moment. This is not the time for it to be about you. Sometimes I hear people say, oh, I did that too, and this is how it felt, and this was what I did, and this is how, and then it becomes about that other person. The other thing, and I want you to write this down. I have a lot of things for you to write down today, but I want you to write this down. Write down the word at least. At least is not an empathetic term at all. So here's how it sounds. Well, at least you didn't fall off the cliff. Or at least you still have your other parent. Or at least your other kid isn't a screw up. Those are, while someone might think that they are being empathetic, they're absolutely not being empathetic when they use the word at least. But here's something you can write down to do. So that was the don't. The do is write down, tell me about. Tell me about. So you have to practice empathy. And with empathy, it's asking questions and then listening. So tell me about your experience out on the road today with customers. Or tell me one thing you do to handle stress. And then listen. Another phrase I want you to write down is, I'd like to know your thoughts on, let me say that again. I'd like to know your thoughts on. So let me show you how that would work. I'd like to know your thoughts on making masks mandatory for everybody. Or I'd like to know your thoughts on coming back to base post-COVID. See, asking and then listening will help you build trust and solidify your currently disjointed team. It'll pull things back together. Next slide. So facts. You may have heard that public transit isn't safe and that people should drive in their own vehicles for a while. That actually came from the CDC, and it was a very harsh statement to make. And APTA has come in and written a scathing editorial about the fact that the CDC came out with that. Your employees have heard this on the news. They may have read it in the newspaper. They may have seen it posted on Facebook. And they may be wondering, okay, if that's the case, what's the future of transit? So to stabilize your workforce and the work environment, it's actually your job to provide the facts. You've been presented today with several examples of fact-based information that you can use today and in the coming weeks. John presented the report from APTA and Johns Hopkins, which will help you ask the right questions as you move forward. You have Jared's SOPs. They will make your work a whole lot easier, and you'll ensure that you're doing it right because it's already laid out in the SOP for you. Giles provided checklist guidance, and with that, that'll keep you on track. And then you had Bill's just exceptional ground zero operations experience, his ideas. And I got to tell you, Bill, you were actually empathy in motion on many of your ideas. I don't know if those were just yours or if you brought in a whole team and came up with these different things, but the goodie bag for your operators, that was a really great empathetic move on your part. I do want you to take a look at this article that's on the screen. It's from The Atlantic, and notice the title, Fear of Public Transit Got Ahead of the Evidence. It says many have blamed subways and buses for coronavirus outbreaks, but a growing body of research suggests otherwise. I've provided this link to CALAC and Caltrans, and I hope that you guys take the time to read it. But I want to point out 4 statements that are made in this article. The first is that none of the 150 identified coronavirus infection clusters, okay, not people, but clusters, from early May to early June originated on the city's transit systems. None of the cases. That's a fact. And that's a fact that you can share with your employees. A second bullet point here is if transit itself were a global super spreader, then a large outbreak would have been expected in a dense Hong Kong, a city of 7.5 million people, dependent on public transportation. See, that didn't happen in Hong Kong. The third point that I want to make is that the MIT report that is inside this Atlantic article says that they did not trace any individual coronavirus case to a subway ride shared with an infected passenger. So not a single case is connected in that way. And the fourth bullet point that I want to point out in this article is many of the highest profile outbreaks occurred far from the nation's buses and subways. 11% of American coronavirus infections and 1/3 of the deaths in the US by early May had occurred in nursing homes, not on public transit. So the fact that the CDC has put out this message that transit is not safe is simply not true. And there's more facts that you can glean from this article from the Atlantic. So to recap, I have 3 points for you. To recap, the first one is be the bad guy, but do it by setting clear goals, asking for input from your team, and being consistent. The second thing is practice empathy. By recognizing that your employees have fear or might be resentful is very important in terms of getting them past this crisis place and stabilizing them for a good, solid work environment for the future. You have the magic fairy dust in your hands, and it's called asking and then listening. Remember the phrase, tell me about, and I'd like to know your thoughts. By writing those down and keeping those in the forefront, you're going to go a long way with empathy. And finally, use facts, share facts so that you improve buy-in, enhance recovery, and also build trust within your transit environment. Next slide. Guess what? It's the end. So Jacqueline, take it away.
Thank you, Kristen. If we could have all our panelists turn their cameras back on so we can answer some questions. Wow, what a great group of speakers. We have a lot of resources, I think, that everyone can use, from practical experience that Bill brought up on hygiene safety training and medical screening of staff, some of the best practices, and the COVID-19 industry guidance for transit and rail, and the checklist from Giles, the SOPs from CalSTART, and the APTA's COVID-19 guide that John talked about so much. And then Kristen, showing empathy, I think, for our drivers and staff and riders even is so important. And then facts that we can use to break the fear factor that's out there about riding the bus. So thank you to all of you guys for all those great resources. And so with that, I'm going to go to our first question, which is for Bill. And sorry you're losing your voice, Bill, but it says, Mr. Churchill, is there a limit to the amount of days you will pay for an employee to stay home who reports having symptoms consistent with COVID-19?
Oh, it's an excellent question. And it was honestly a raging debate where to draw those lines. So the way we drew, or where we drew the line, was we decided it would be 2 weeks is the minimum. And then on a case-by-case basis, we could make a decision to extend that if needed. What we found is actually only 2 weeks was ever really necessary for all but one case. And the one case where our operator came down with the infection, they were in the hospital on a ventilator for 3 weeks. And so their illness was rather profound. In fact, they are still struggling with health issues that emanate from the virus. And we decided that we would just continue to pay that individual all the way through.
Wow, thank you. And talk about empathy. What a great example of what you're doing for your employees. Next question is for everyone. Has anyone seen or heard about or come up with a type of shielding for the paratransit vehicles?
I have a case study that I could share. If you look on the internet, think it's in Detroit. There is Honda partnered with a paratransit operator to develop a series of a small subfleet of vehicles that were used to transport COVID positive paratransit riders to from medical appointments, whatever. And what they did is very simple but very smart. Honda created a plexiglass barrier to start out with between the driver's compartment and the this was a minivan. So plexiglass between the driver's compartment and the passenger compartment. And then what they did is they punched, some thoughtfully sized holes in that plexiglass. And then they put some external ventilation from the passenger compartment to the outside. And what they did is they rigged up the HVAC system so that the driver can turn on the HVAC, create positive pressure in the driver's compartment. And that positive pressure from the HVAC system in the driver's compartment ensures that conditioned air can get back to the passenger, but that air from the passenger compartment can't get back to the driver. This concept of using the existing HVAC system, creating zones of positive and negative pressure, is not novel in of itself. This is a technique that's used in hospitals to as part of their containment strategy for keeping germs in a particular room or out of a particular room. But it was, I thought, a really innovative way to look at in a small vehicle where it's impossible to socially distance operator from passenger to create a barrier against droplets, and then also not allow anything that might be airborne to transfer.
Thank you, John. Any other panelists?
I'll say that as I've been listening to people around the country talk about this, some people say that the plexiglass is too expensive, but then when they looked locally for a source, don't just get online and try to find something, but actually look around for a local source, someone that has plexiglass and can work with you and retrofit things locally. You can save a lot of money that way.
To echo what Kristen said, that's what we did. We locally sourced our plexiglass. We were able to build all the barriers for about $200 a piece. If you were to buy those barriers from a major manufacturer like Gillig or New Flyer, they would cost you about $3,000 a piece. So that shows you what the dollar volume difference really is. In terms of barriers on paratransit, we don't yet have our solution designed, but we are in the process of working on it. Once, if we complete something, of course, we would make those designs available. And the fixed route plexiglass doors, of course, anybody who's interested, reach out to me and we will get you those designs. We are sharing them with many operators in the Bay Area as we speak.
Thank you, Bill. I did have a comment from our audience that Creative Bus Sales has developed driver protective shields and are selling them to operators also. Any other comments from our panel? Okay, I will go to the next question. This is for Bill again. Bill, are workers over age 65 back to work yet? If not, when are you planning to bring them back? And are the over 65 still out on full pay?
All the over 65 employees are back to work. None of them wanted to stay out. I think actually I'm wrong. One employee stayed out longer than the 2 weeks. They were out 4 weeks. They did have some serious underlying health issues though, but all other over 65 demanded to return.
Thank you. Okay, so next one is for the whole group. Has anyone found any effective engineering technology solutions to conduct automatic temperature checks for their essential workers?
I can speak a little bit to this. you'll see with airlines and in other industries, in transit and rail outside of the US, there's this growing use of thermal cameras to help screen people for body temperature. I've had a lot of conversations with some folks at Hopkins about this. It seems to be not a good tool. If you're trying to just screen masses of people while they're in motion, it seems to be a better tool. If you're going to use it as like a checkpoint where an individual stops and is standing in one place to get screened by a device like this, there's also, you know, different versions of devices out there like this. There's those that are developed specifically for screening body temperature, and others that are, you know, that a contractor might use to detect drafts in you know, a window or a door or something, and, you know, clearly you want the former, not the latter. And the other thing is, you know, the advice that I've been getting is that these things are good as like a preliminary screen. It might help you decide who else you want to check with a temporal thermometer, and none of these things should replace a questionnaire where you're really going through the full list of signs and symptoms. These things are good supplements that can be considered for the toolkit for screening.
Any other panelists want to try that one?
I actually have a question for John on that, because I was going to say the same thing. Every time I've been overseas, there have always been thermal cameras. Do you know what the feasibility is, or the cost feasibility is for something along those lines?
I don't.
Okay. Yeah, I wasn't
get an answer tomorrow, but I don't. Yeah.
But I would also bring up what Bill did with offering the incentive, I guess the protection to have his employees go home is incredibly important and still have a paycheck, because if somebody's living paycheck to paycheck and they lose that if they're feeling sick, as we've seen this in other industries just with the flu, people will choose to go to work sick just to make sure that they're able to get paid, which is completely understandable when you're trying to feed your family. I think what Bill and his agency did was fantastic to be able to provide that security for all their employees, so they could make that decision without having to worry about not getting paid versus, you know, possibly infecting other people.
Thank you. That's a great comment. We kind of have a follow-up one, and maybe you sort of already touched on it, John, about, do you see some sort of auto temperature check systems coming for transit buses?
I mean, it's possible. There's I would put all of this in this bucket of emerging technology. You know, there are things that have been considered emerging technology in this pandemic that were taken right off the shelves. There are things that have been very successful, and you know, there's still a whole bunch of questions around the. If you look, the Food and Drug Administration has a whole page on their website dedicated to nothing but these thermal cameras, and considering the trade-offs in how you might buy and use one of these things. You know, so some of the other questions not related to taking of temperatures is, even though it might be entirely unintentional, does it turn out that people of a certain gender or race like tend to run hotter than others? You know, like with facial recognition technology in the past, you know, an unintended consequence of that facial recognition technology is it was flagging certain types of people for certain things. And so there's still these questions. I mean, generally my personal opinion is that, you know, somebody could, I would say this is a great question to work with your health department on. That's probably the best answer possible, is to like what Bill, I was just like, I was doing the sign of the cross while Bill was talking about his early and frequent engagement with the health department. And candidly, the health officials, they're not just there for medical advice. They're there to think about equity. They're there to think about all of the human psychological components that go into our overall well-being. And so whoever asked that question, I'd say this is a fantastic basis for you to have a conversation with your health department and ask them their thoughts on this.
Thank you, John. Any other comments on that? Okay, I will move to the next question. Is anyone considering contactless fare technology? Bill, I see you smiling.
Well, so yes, and I've heard that there are other operators across the nation in different parts of the country that are not only looking at it, but in the process of implementing it right now. In the Bay Area, we are really beholden to the regional approach, and really under MTC and the Clipper card system that ties 9 counties together into one payment system. So I can't just willy-nilly on my own come up with a different system, as much as at times we really would like to consider it.
Thank you, Bill. The rest of the panel, have you heard of other operators that have gone in this direction?
The ones that I'm aware of went in this direction not because of the pandemic, but you know, they were going in this direction for other benefits. But it, you know, it is an expensive proposition. It's an expensive migration to move, and I'm sure more operators are going to want to move towards contactless fare payment. But you know, as Bill mentioned, a universal problem everybody's having is money right now, and so this is going to be a big tension in the transit industry, is figuring out how there are certain capital improvements that could be made to improve the safety of the transit system, but there's significant capital constraints that we haven't had to contend with before.
Agreed, John. Yep, that's definitely what I'm hearing also about the about capital improvements. It's sort of a back burner right now, but also the cost of agencies that are using the contactless fare systems. It is going into a regional approach, and it is there's a lot of there's a lot of issues involved in it, including your Title VI issues that go along with that. So I'm sure people are thinking about it, but not just for COVID, like John said.
Okay, couple questions about masks. How do you enforce mask requirements for passengers or visitors? How do ADA guidelines apply to mask requirements?
Well, the information we've received is somewhat varied. We've even heard that we did not ask FTA. Sometimes it's better not to, and I probably shouldn't say that on this, but FTA guidelines have said that you can't require it. But our current county health office has said it's required. And so we've decided that we are going to follow their guidelines, and we do require it. However, if an operator allows a passenger without a mask on the bus, we are not going to discipline that operator. When we began that requirement, this was back in April, and I don't remember the week, but we put up signage saying that a mask is required for all customers on a vehicle. We actually sent our supervisors into the field, driving around with boxes of masks, handing them out to customers and educating them about the need for masks. And it's interesting because initially we had pushback, but then when we pulled the mask out and handed it to them, it was, oh, okay. And it really hasn't seemed to be that big of a problem now. It's been months, and once in a while you get it. But it doesn't have to be a mask either. If somebody puts and pulls their shirt up over their nose, the operator says, okay, that's all right, you can get on. So I don't know if that helps.
Yeah, and there are some agencies, Bill, that are not allowing that. It has to be a face covering. It doesn't necessarily have to be a mask, but the T-shirt up is too easy to come down again.
Right.
Something that is a little more secure, like a bandana or a scarf or a something like that. The other thing some of the other things, it does go to consistency. And so you have to decide, do you want your operators making that decision in the field? I've heard some agencies that actually stop the vehicle and say, well, if you're not going to wear it, then you can't ride. Or they might say, you need to get a mask on and we can't leave until you do. Or we have to wait for a supervisor to come and talk to you about the mask. So different agencies are taking different approaches about that. I'm most interested in the ADA question, and agencies are making accommodations for people who are unable to wear the mask for medical reasons. And that's the right thing to do.
I'd add to that, children under the age of 2, there's some general guidance out there that we don't want to see them wearing a mask either.
Mhm.
I'll add one more thing to the conversation. I don't know if we'll ever fly in the United States, but I'm aware of at least 3 cities in Europe where the city has passed an ordinance that says that they are going to generate a financial penalty for any riders not wearing a mask. It's up to the city police to enforce it. And then the city and the transit police work in tandem. Like the police are generally out there to encourage and not to be bad people, but I guess just to answer the question, that is the one example that I'm aware of where there's like a hard enforcement policy in place.
Well, I think it's good that Bill has the backup of his health department. That's really important, and the ones that are successfully being able to implement an everyone must wear a mask protocol are the ones that have backup from their health departments.
Yeah, I think that's good advice. One of our attendees did send in a recommendation that said health precautions must be implemented equitably. If an agency decides to require a mask to ride a transit vehicle, it must apply the requirement to all passengers, fixed route, and ADA paratransit. Applying the policy only to people with disabilities raises concerns under the non-discrimination requirements in the ADA regulations at 49 CFR 37.5. Transit agencies should contact local and state public health officials to make decisions about health precautions in consideration of local mandates and how to best implement them. And they said, look at the FAQs on FTA's website on COVID-19. But so just a precautionary note from our attendee.
So Jacqueline, I will say that there are, in terms of the equity across the board, another thing that I've heard is no shirt, no shoes, no mask, no service. That they're thinking of it in that same way. If you can require someone to wear shirt and shoes, then you can require them to wear a mask. But you do need to make accommodation for those that for health reasons cannot.
That's a good point. I mean, I think most operators that I've heard from are requiring them of all riders, not just the riders with disabilities, but all riders on fixed and
absolutely.
Yeah.
Across the board.
Yeah, especially when it's a county mandate, like in Bill's situation, or I think most of the counties in California have that mandate. So thank you for that advice, but I think hopefully, I know most of our operators are adhering to that because we've received information from FTA earlier in the year. So thank you. Okay, our one of our very last questions, we have 2 more. Has anyone looked into UV lighting for bus sanitizing?
We have. I guess I'll start. This is something that we are considering and have spent some time looking at and analyzing. So HVAC, I think, is going to become a fairly significant subject for transit across the nation. And how much clean air uptake do you have built into the system? Positive pressure, negative pressure, all those things are being evaluated right now, including filtration and UVC lights. It's not just the whole UV spectrum, it's the UVC spectrum that actually kills the bacteria and viruses. The HVAC systems that we are using on our buses actually have an incredibly high flow rate. We can completely replace the air on a full-size 40-foot bus in under 2 minutes. but the speed that generates in the airflow is most likely too fast for the UVC to be effective at killing viruses and bacteria. You need to have what's called dwell time. The air needs to slow down. Hospitals use the UVC systems in the cold air returns, and they create banks of light so that the bacteria and viruses are exposed for a period of time, and then it kills them all off. So we're not sure how effective it would be in our application. We're still conducting tests and evaluating it, but we haven't ruled it out, but we are looking at it, and that's our initial thought on it so far.
I can add a few things on UVC. One is there's plenty of proof of concept for other germs. I know that New York MTA has been working with a professor that has in a lab, still subject to repeat experiment and peer review, but has in a lab successfully inactivated SARS-CoV-2 with the UVC spectrum. But that's in a lab. There's resources on CDC's website that back in 2016, when they were testing UVC to disinfect the interior of an ambulance, they found that there were a ton of factors that went into how much light, like how long do you need to shine the light, and those factors include but are not limited to ambient temperature and reflectivity of surfaces that are in the vehicle. And so, there's discussion about UVC being used in an HVAC system. ASHRAE has put out a position paper saying that in general, they think it could be considered for infectious disease control, not specific to this particular disease. But ASHRAE is not putting it out, like Bill said, to clean the air, so to speak. There's this whole concept of disinfection of surfaces with UVGI. So some of you may have seen the photos of the buses in Shanghai that, in theory are being disinfected in like 7 minutes by being blasted with UV light. And so, New York MTA has a pilot going on right now with their subway car fleet, where they're trying to dial in the duration. But ultimately, it comes down to the particular vehicle. You could dial it in for one type of vehicle, and then you need a different recipe for the next type of vehicle, even after you get through all that. And then there's still some questions. I mean, ultimately, this is an area of emerging research. There's still some questions also about safety. UVC is damaging the human tissues, eye, skin, all of that. And so, for the people whose job it is to apply the UV light, there's an occupational hazard question. And then also if somebody needs to maintain that equipment, and this is not to discourage, right? Like, this is a very helpful technology with other germs. This is an encouraging technology for this particular disease and controlling the virus that causes it. I guess the only point is to say that there's a bunch of asterisks on, how, and people shouldn't proceed without recognizing what those asterisks are. And if you do, then that's beautiful. And again, health department, great partner for exploring how you do this.
Thank you. Other comments? Okay, looks like we have one last question. So if you guys have any other questions, you need to get them in quickly because we're coming to the end of the webinar. But how often should you provide safety training on COVID-19? And are you providing it to employees as they return to work after being off?
So at County Connection, yes, we are providing the training upon return to work. We have been conducting training now weekly, and we also incorporated it into our DMV required VTT training program. So and I think it's going to be within sort of a myriad of our training programs, and it's here to stay. So the goal is to hit not just once, but multiple times continuously. And I don't see an end to it at this point.
Human nature is we're going to do what we know. and fall back on what we're used to doing and what we're most comfortable doing. And a lot of the things that we need to be doing now to keep us safe regarding COVID-19, some of them are things we learned in kindergarten, like wash your hands, and don't put your hands all over your face. But as adults, we kind of I think that there's some people need to be reminded over and over again, and repetition is the best teacher. So I'm all for keeping the conversation out there. There are transit directors that I've heard say, even after having a driver meeting, and I go in and I tell them, this is real. You need to wear your face mask. You need to stand 6 feet apart, and goes through all of the rationale about it. She said as soon as she walks down the hallway, the operators are all clustered together, huddled together, talking and joking. And she said it's frustrating because they just are not getting how serious this is. I think the more facts we use, and the more consistent we are with messaging, and the consistency in terms of policies and procedures, it's going to become more of a habit and more of the right way to do things. But it's going to take a long time for that to happen.
Agreed. Any recommendations, John, Giles, or Jared, from your guidelines that you say how often it should be done? Should it be part of the pre-trip inspection, having that training like a checklist before you inspect your bus and take off for the day, or what should we be doing?
I'll go ahead and start here. I really like that, Kristen, how you said that this just needs to be something that's part of repetition, because it's one of the concerns that I have moving forward. And again, I'm based in Florida, so we just opened it up like this is not even a thing anymore. So it's very concerning to me to see people kind of letting their guard down and wondering how we keep transit operators safe as well as other passengers safe in this scenario where people are kind of pulling back, where they're just saying, look, it's no longer a big deal. We're kind of getting past it. It's not as bad as we thought it was. How do we keep operators safe? And I believe, Kristen, you really hit it on the head. It's all about human nature. Like how are your processes structured? So I do believe putting these processes and procedures in place now and constantly training them, or drilling them into your drivers, into your maintenance staff, keeping all of your protocols in place, and not so much getting rid of the gains we're making now in terms of our procedures, but pushing those forward. And those just become something that when you hire somebody on, this is just part of it. It's not like there is a pre-COVID and post-COVID. This is our policy from here on forward. I think that's the way that we have to look at it, is we need to train everybody just as we normally would. That we're training in this new element to their training, or I guess putting this new element into their training as we move forward. So I would highly recommend making this a fixture, because it's not just COVID. I mean, we still have to deal with the flu every year. These are good practices to put in place that will cover a myriad of diseases that are out there, and it will help everybody in the long run. So I think we should keep these in place moving forward, and it should be something that we train on consistently, just as you would anything else. And it just becomes habit for all of your operators, maintenance personnel, administrative personnel moving forward.
Thank you. Any other comments? Okay. Well, that's the end of our webinar, and I really want to thank our panelists, Giles, Jared, John, Bill, and Kristen. You guys did an excellent job. I know I learned a lot today. I'm hoping all of our attendees learned a lot today. As I said earlier, all the PowerPoints and the recording and the handouts from the webinar today will be on the California Transit Association and the CALACT website. Please give us a day to put them up, but they will be up there tomorrow, so you can download them and recommend them to other staff that were not able to attend today. I want to thank the California Transit Association staff and my staff, Tinley, for running all the slides, and everybody for helping put this webinar together. And we're continuing these talks. When we start in July 8th, we will be going every other week to give people a little break. But next week, we're going to be having a webinar on financial planning in a crisis. So stay tuned for that next Wednesday at 2 o'clock. And I hope everybody stays healthy and happy and safe out there. And thank you again for tuning in, and have a great rest of your week. Thanks, everyone. And a big round of
too.
applause, virtual applause for our speakers. Thank you.
Thank you.
Bye, everyone.
So long.
All right.